head and neck assessment, you'll want to provide privacy, wash your hands, and explain to the patient what you'll be doing. And you'll want to gather your supplies. You'll need an otoscope to look at the ears, a tongue blade to look in the mouth, a pen light to assess the eyes, and gloves. So let's get started. We are first going to inspect the head, and we are looking at the skin color. It's nice and pink. We're also going to make sure that the head is the same size as how it should be for the body, and it is. And we're looking for any abnormal movements or twitching of the face that he can't control that are involuntary. We don't see anything. And we're making sure that the face is symmetrical. There's no drooping on one side, like in this picture. There's drooping on one side of the face, and this can be seen in Bell's palsy or in stroke. And we're also just looking at the eyes and the ears. Are they at the same level? And while we're here, we're going to go ahead and look at the facial expressions and test cranial nerve 7, which is the facial nerve. So can you close your eyes tightly for me and open them up? Okay. Now smile for me, frown, and puff out your cheeks. Okay, and he did that with ease, so that cranial nerve is intact. Next, what we're going to do is we're going to palpate the head, the cranium. We're going to check for any masses, indentations, look for skin breakdown, any infestations. And for this part, I like to wear gloves. So let's look at the hair. So what we're doing is we're feeling for any masses, indentations, and also with this, we're looking for any skin breakdown. And if your patient's immobile, you really want to check the back of the head back here because they're laying on it a lot, and there can be breakdown back there. Also, while you're doing that, look inside the hair. Make sure there is no infestations like lice, and there's no abrupt, like rounding areas of baldness, which could represent alopecia. Then after that, since this patient has a beard, you want to check the beard as well, any lesions, any infestations or anything like that, and just look around. And then once you're done with that, what you want to do is you'll doff your gloves and perform hand hygiene. Next, what we're going to do is we're going to find the temporal artery and we're going to palpate them bilaterally, and they are both found right here. And his are about a 2+. And then while we're right there, we're going to go ahead and test cranial nerve 5, which is the trigeminal nerve. And this nerve is responsible for many things like mastication. So what I'm going to have you do, Ben, is I'm going to have you clench your teeth, like bite down for me. And I'm going to feel the masseter muscle, which is right there, and it should be a nice firm ball. And then feel the temporal muscle. Now what I'm going to do to also test that nerve is have him try to open his mouth against resistance. So try to do that for me. Okay, and he can do that. Now, while we're here, we're going to go ahead and feel the temporal mandibular joint. And we're going to feel right here, and I'm going to have you open and close your mouth. And I'm feeling for any grating or clicking sensations, and I feel none. Then we're going to palpate the sinuses. And I'm going to put pressure on these two sinuses right here, and you tell me if you feel any pain, okay? So the maxillary?
No.
And the frontal?
No.
Next, we're moving down to the eyes, and we're going to inspect the eyes first. And we're looking at several things. We're looking at the eyelid. We're looking at the sclera, which is the white of the eyes. We're looking at the iris. We're looking at the pupil. And we're looking at the conjunctiva. So you shouldn't see any swelling of the eyelids. You should see that the sclera is white and shiny. It shouldn't be yellow like in jaundice. And the conjunctiva, when you pull down the lower lid, have the patient look up, it should be nice and pink. It shouldn't be red. You shouldn't see any drainage or anything like that. Then look at the eyes. How do they set in the eye socket? Are they equal? For instance, is there any strabismus? Is there a cross eye where one eye turns in more, turns out or up or down? And these eyes are normal. There's no strabismus. Next, you want to look at anisocoria, where one pupil would be smaller than the other pupil. Are they equal in size? Normal pupils should be 3 to 5 millimeters in their measurement, and here his are about a 3, and they are equal. Next, what we're going to do is we're going to assess some cranial nerves. We're going to be looking at cranial nerve 3, which is oculomotor, 4, trochlear, and then 6, which is abducens. And we're going to do several tests to check their function. The first one, what we're going to do is we're going to be looking for any involuntary shaking of the eye called nystagmus. And how we're going to do that is we're going to take our pen light, we're going to hold it about 12 to 14 inches away from the patient's nose. And Ben, what I want you to do is keep your head still, don't move your head, and just use your eyes to watch where I move the pen light. And as you're doing this, you're going to perform it in the 6 cardinal fields of gaze, and you're just going to move it, and you're looking for any involuntary shaking of the eyes. So here we go. Next, we're going to see how reactive the pupils are to light. And to do that, we're going to dim the lights a little bit, and we're going to have the patient stare off at a distant object. That helps dilate those pupils. And then we're going to shine, using our pen light, in at the side. And we're going to see how that pupil responds. It should constrict. And then on the other side, it should constrict as well. So say their baseline pupil size was like 3 millimeters. It should go down to 1 milliliter, and it should happen on both sides. Okay, so Ben, stare off at that object right on the wall over there for me. Okay, and that dilates the pupils, and we're just going to shine light in at this side. Okay, constrict, constrict. Okay, dilate again, and then go to the other side. Do the same again. And they both constricted in equal size. Next, what we're going to do is we're going to check for accommodation, and how we do that is we turn the lights back on. We just previously had them dim, but we now make it light again. We're going to have him stare off at a distant object. That helps dilate the pupils, and we're going to take a pen light. You can use a pen light finger, and you're just going to slowly move it inward to the nose. And what you're looking for is that those pupils constrict, they accommodate, and the eyes cross while looking at the pen light. So here we go. Stare off in the distance, please, and I don't want you to move your head or anything. Just keep it real still and just follow this pen light, okay? Ready? Okay. So now we can document, because we just checked all of the things with the eyes, we can document that the pupils are equal, round, reactive to light, and accommodate. So that's where that acronym PERRLA comes into play. Next, we're going to move on to the ears. So first, what we do is we inspect the ears. We look on the outside of the ear. Is there any abnormalities, any redness, any drainage, anything like that? And Ben, are you having any pain in your ear? Okay. And sometimes if you have patients who've had long-term gout, on the helix of the ear, they may have what's called a tophi, which is an accumulation of like a whitish, yellowish uric acid crystal on the skin. So if you ever see that, that is what that looks like. Next, we're going to palpate on the ear. We're just going to move it around. And Ben, tell me if you have any tenderness whenever I do that. And feel any abnormal masses or lesions, and then move the targus a little bit. Does that hurt or anything like that? No. Okay, so no pain or tenderness. Then we're going to palpate the mastoid process, which is the big hump behind the ear, and we're looking at it. Is it swollen? Is there any redness? And whenever I touch on it, Ben, does it hurt? No. Okay, and just see if the patient reports any tenderness with that. Then while you're there, you can use the otoscope to inspect the tympanic membrane. And remember, the tympanic membrane should be a pearly gray translucent color and should be shiny. So for an adult, you're going to pull the pin of the ear up and back. And we're just going to inspect it. And also, while we're looking at that, we are looking at the cone of light. And remember, the cone of light in the right ear should be at 5 o'clock. Ear should be at 7 o'clock. Next, we're going to do one more thing with the ear. We're going to test cranial nerve 8, which is the vestibulocochlear nerve. And what I'm going to do is I'm going to include one of his ears and then whisper 2 words on the other side. He needs to tell me what I said. So, you ready? Mm-hmm. Okay, I'm going to include this one.
Apple, banana.
Okay, very good. Okay, and that nerve is intact. Next, we're going to move on to the nose, and we're going to inspect the nose. We're going to make sure it's midline on the face, which it is. We're going to look at the septum. Is it deviated, anything like that? And ask the patient, are you having any trouble with your nose? Are you having any drainage or anything like that? No. And you want them to you want to check the patency of the nose. So then I'm going to have you occlude one side of the nostril, breathe out the other, and vice versa. Okay, heard airflow. Airflow, nice and patent, because sometimes people can have polyps that can block it or the deviated septum. Then you want to take your pen light and you just want to look inside the nose, look for any drainage, redness, or any like polyps or anything like that. And everything looks clear, I don't see anything. And then we're going to test the olfactory cranial nerve 1, the sense of smell. So Ben, what I'm going to have you do is I'm going to have you close your eyes and I'm going to put something in front of your nose and have you breathe in and smell, and you tell me what you smell. And whenever you do this, use something that's pleasant smelling, not something that's really stinky, because it could elicit like a gag reflex or something like that if the person has a sensitive nose. Okay?
Vanilla.
Okay, and this was vanilla extract, and that is correct. So that cranial nerve is intact. Next, we're going to move on to the mouth. And for this part, like to wear gloves. And if your patient is coughing